Welcome to the LynnCAM TV Show, a program which focuses on organizations in and around the city of Lynn. Here with me today, we have Mary Wheeler, Program Director, and Denny DeRocha, Community Health Educator of Healthy Streets Outreach Program. These guys are located at 100 Willow Street on the second floor, right here in Lynn, Mass. You can reach them at 339-440-5633. You can find them on Facebook, Healthy Streets Lynn, Mass. So now that our audience knows where they can find some information, we're here to talk about your organization. Before we get too much into that, I'd like to learn a little bit about you guys and how you got involved. Mary, we'll start with you.
I have been doing HIV and overdose prevention for about 15 years now.
Wow.
So I started working with folks who are drug users and sex workers when I was about 17 years old.
No kidding.
And have since started programs and come up now to be a program director. So.
Yeah, so you're the head honcho over there. And Denny, he's one of your reliable employees. Let's learn a little bit about him.
Okay, born and raised in Lynn. I come from a family where we're active users in my family, and I just like to give back to the community that I was born and raised in.
So you had dealt with this firsthand.
Yes.
So this has made an impact in your life. Is that the same case for you, Mary? Mm-hmm. Yeah. Okay. So that tends to be that seems to be a correlation on the program. Anytime we get outreach workers focused on one specific field or maybe just something that needs to be done within the community, they've usually dealt with this stuff hands-on, and it's affected them in their lives, so which calls for more passion in their work, which ends up working out very well. So Healthy Streets Outreach Program, 100 Willow Street, second floor, Lynn, Mass. Let's talk about the organization as a whole. Went online, did a little bit of research. Harm reduction is a big part of this. What you guys do, HIV/AIDS and overdose prevention, it's a program that's over there. They're open Monday through Friday at 8:30 a.m. to 4:30 p.m. They've got drop-in hours, free HIV testing. We'll get into that, hepatitis C testing, STI testing, and then we'll even get into the Narcan training that they do over there, that program. But let's talk about the organization's function. Mary?
So Healthy Streets is a program of health innovations, which is run by two women, and they're kind of our lead organization. We help us manage our contract from the Department of Public Health, and they have an office in Dorchester, and then we run the Lynn site under Health Innovations, as well as we work with them on mobile clinics. So we have mobile clinics across the state under Health Innovations, where we bring nursing care and Narcan training and services to places that don't have a community health center, where people are underinsured or uninsured. But the Lynn site specifically, Healthy Streets has been a program in Lynn for many, many years, way before me. I've been there about 10 years now. And we are Department of Public Health funded, the Office of HIV/AIDS, and our program has expanded since 2007 to be part of one of the Narcan pilot sites and do overdose prevention training and Narcan distribution to active users, former users, and their families. So Healthy Streets was originally started to tackle the HIV/AIDS epidemic among IV drug users on the North Shore. Wanda and Paul Hearns had started the program along with another gentleman, Gary Landris, and they were just totally street-based, handing out bleach kits and doing education with people on the street who were using drugs. And it's since evolved into, a full-time program. We have an office and a lab, and we go all over the North Shore.
Yeah, it's an outstanding program, and what it is now, it wasn't always that way in the past. And we're going to get into the history, but from what you were telling me before the program, there was a lot of opposition that you faced, and based on what you were trying to do. We are the people. It's important. There's a situation that needs to be addressed. I mean, it's your right, and not only is it your right, but it's your responsibility as a citizen to step up. If you can make it happen, why not you, right? Nobody else is going to make it happen. So sometimes you got to step forward, and that's exactly what you guys have done. So I want to commend you as a Lynn citizen. One interesting thing to point out about your organization, that it's a North Shore original. Right? Mm-hmm. You had mentioned that it started up in Beverly before earlier you were saying 15 years the organization's been around. We're going to get into the history, which is actually very interesting, but I'd like to talk about some of the programs that you guys offer. Sure. Now, harm reduction, right? It seems pretty self-explanatory, but I'm sure there's more to it. Tell us about that, whoever wants to take it.
So harm reduction is like we meet people where they're at and then go from there. We're not abstinent-based where we're pushing people to get into detox right away. We work with them. If they just need even just a cup of coffee and to talk to somebody and get free testing, or we have clean supplies like bleach kits, and we also hand out like tourniquets, and like we said earlier, we do the free STD or STI testing, HIV, and Hep C testing. But we're also there that way if in the time that they've come in, usually we build a rapport with them, and then from there, if in the future they want to get into a detox, they feel comfortable enough to come to us and allow us to make the calls for them to get them into the proper detox for them.
You had mentioned that sometimes they just want to go out and have a cup of coffee and talk, and usually that's the first step, man. I mean, a lot of these guys, they don't have people who they can go to because they've used their resources. Their bridges have been burnt, and they're there's a no comeback option for them. So what you're doing, I mean, like, you're dealing with a part of the public that is, I would say, among the most difficult. You know, if you're a bank teller, you deal with people, hey, how's it going? Have a nice day. Oh, blah, blah, see you later. And you got people coming in, and they're like, my life is in shambles right now. Can you do anything about it? And you guys are just like, yeah, that's incredible. I mean, if I could do that once a week, more than I do already. I mean, it wouldn't be close to what you guys are doing, but you know, the people in my life would probably be better off. So a little something to take. I'm reflecting right now. You guys are inspiring me. So let's talk a little bit about some of the other the Narcan training. I saw this. I tried to do a little bit of research. I was pretty dumbfounded. I didn't know much about it. What is Narcan training?
So Narcan, or naloxone, is an opioid antagonist, so it does the opposite of what an opiate does to the body. So if somebody does too much heroin, does too many Percocet, does too much methadone, they can go into an overdose, they stop breathing. And this medication that we distribute is given nasally. So you give them the nasal spray. If they have a heartbeat, what it will do is it goes into the brain and cuts off the opiate from working and starts the breathing again, so the person starts to slowly come back. They usually don't know what's happened, so sometimes they can be confused or agitated. But what it does is it gives you a 20 to 90 minute window where they're breathing, where you can get them to the hospital, get them care. Ideally, you'd want to watch them for 2, 3, 4 hours to make sure they don't go back into the overdose once the Narcan wears off. It's been an amazing program. In terms of harm reduction, we still get a lot of resistance from some entities about it.
What for, though?
So the whole harm reduction message is kind of giving you messages to stay alive no matter where you're at in your life. So we deal with people whether they're using totally chaotically, you know, living the streets, shooting all kinds of drugs, all the way up to long-term abstinence, like Denny said. Sometimes people that stop using are most comfortable with our team because we kind of meet them, you know,
right.
We were always there. We were never, you know, oh, you've been here too many times, you've relapsed too many times, you can't come back anymore. So part of the resistance to the Narcan is that we give a message of don't use alone, which some people find is condoning drug use, which is one of the things about harm reduction that we struggle with, or that giving out the Narcan is encouraging people to use more. But if you know anything about drugs, if you have $100, you're going to use $100 worth of drugs. If you have $30, you're going to use $30 worth of drugs.
Right.
It doesn't matter whether or not you have Narcan on hand.
Yeah, I mean, that's not fair. I mean, what you're trying to do is you're trying to approach this in a healthy situation. I mean, realistically, these guys are going to make the decision on their own, right? And it's like you got to point it out. So it's surprising to me that you're facing opposition. There are people out there, oh, you're condoning drug use. And the fact of the matter is that there are drugs out there for them to use, and they're going to use them. So if they don't know how to use them, then why? I mean, like, wouldn't it make sense to put them in a situation where maybe they can avoid death or avoid infection?
The Narcan, especially, and we talk about this in the detox every week. We go to the men and women's detox in Danvers and do some training and talk a little bit about how sometimes the only person that's going to care enough is another person using drugs with you to help save your life, or your family members. So we do a lot of Narcan training with parents who still have kids at home that are using. It's been an amazing program for us. Every now and again, it's a lot easier than some of back in the days, 12 years ago when we were still getting arrested for giving out syringes. And,
right. So the government was you faced opposition with the government. They were like, this is against the law. You're condoning drug use.
Long time ago, yeah.
And in actuality, what you're doing is you're trying. I mean, the goal is to get them off drugs. The goal isn't like, all right, how long can we keep this guy doing drugs so he doesn't get arrested? That's not what they're trying to do here. What they're trying to do is provide a healthy option for them to find a way out. And a lot of people can't find their way out. It's so dark. It's like there's nowhere to go. So you guys are the light at the end of the tunnel. Narcan training. That's interesting because somebody, you don't know a lot about drugs. It's like, how do you appeal to somebody who is using? And it's like, they're not going to listen to you unless you have some sort of understanding of the lingo, unless you have an understanding of like what they're going through, why they seek this, what drove them to that. It's tough what you guys do. And I mean, I don't mean to get too deep, but it's important to recognize the effort that you're putting in, and it's tough. And all right, let's move forward. I want to talk a little bit about the history of the organization. You touched base on this before, Mary. You want to take this one?
So, like I said, it's been DPH funded, started grassroots, on foot. There's been a few times over the years. This past summer, we didn't have a location, so we were working, back out of the trunk of my car with all of our gear back there, driving around, finding people where they were. And like I said, it was in response to the HIV/AIDS epidemic among IV drug users, and has since just grown and expanded. And we've had some private funds, we've had DPH money all along. So they're our primary funder, which is great.
Can you speak to like what has been achieved? Are the numbers of HIV and AIDS going down? Tell us a little bit about that.
So HIV/AIDS among IV drug users is, in Massachusetts, the new infections are between maybe 9 and 12% of all the new infections in Mass are from IV drug users. And I've been testing people for HIV for about 13 of the 15 years. And I can count on one hand the clients that have become newly infected while they were involved in programming with me. So it's still there, it's still happening. And one of the things we talk a little bit about is with the cutback on prescription drugs, there's been an increase in heroin use as well as IV heroin use. So we're trying to pay attention to see if those numbers start to go up.
Yeah, it's something that you read about in the news a lot more. When I was in school, I mean, even you, I mean, we were on the same time, right? 2001, 2004, English guy, classical, it's different. But, it's just, it's a touchy subject, and it's because there are so many people who are facing this situation. It's real life. And like, even for me to just be sitting here talking about, this guy's wearing a tie, like, what does he know? And I understand, and there's not a lot that I can do, but I can help try to raise some awareness about what these fine young people are doing. The important thing that I want to point out to is that you're facing a lot of struggle. You're taking on a lot, and you're not getting a lot in return. I mean, you said that you worked out of your car. Like, there was nobody there like, hey, make sure you have a paycheck on Friday. It's like, you have your own life to live. Like, I want to kind of get into why you guys did this. I mean, if you're open to talking about it, I mean, what drove you? I mean, Denny, we'll start with you.
Okay, I'm just a people person. I just like talking, hearing people's stories, and there's a lot of stigma behind it. I hear a lot when I first started the job about 3 years ago. People were concerned, like, you worry they're going to run up on you and try to stick you with a syringe, and it's not like that. They're human beings just like us, Their struggles are just a little bit more deeper than ours, and to be able to sit there and have a conversation with just an everyday person, even though they're looking at life in a different way than I am, doesn't make them a bad person. It just, that's the route that they decide to choose, and I'll try to help out the best I can to make their life a little bit easier.
Now, you're a community health educator. For those of us just joining, we're here discussing Healthy Streets Outreach Program. They're on the second floor of 100 Willow Street. You can reach out to them 339-440-5633. We're here right now with Mary and Denny. Denny, I want to talk a little bit about your job, what your responsibilities are over there. I mean, what do you do on a day-to-day basis?
So we come in, we do the testing, the Hep C, the HIV, and the STD or STI testing. We also do Narcan or naloxone training. A lot of times we go out to the methadone clinic or Danvers Detox, or we work on the health van that we have. We also have a drop-in space that we have open for maybe an hour or so inside our office for people to come and have coffee, to talk about anything along the lines that they might be affected by from drug use, whether it's abscesses, cellulitis, or endocarditis. We have pamphlets there for those, Hep C and HIV, that we give out, and clean supplies if they need them.
Very important. Mary, what about you?
I do everything the staff does. So I do all client service, do all the testing, do all the Narcan. The only difference is that I have to go to, meetings sometimes and take more phone calls and return more emails. And
I know you guys are open 8:30 to 4 Monday through Friday, 4:30. This is Monday through Friday, but I have a feeling that your hours don't end there.
No, not usually. I mean, it depends. Sometimes, I'll get calls on the weekends, or the other thing is we always tell folks to give us a call in the office beforehand, because like tomorrow, for instance, Denny may or may not be there because a client needs transportation to detox, so he may be the only one that can take them, or somebody might call in crisis. We'll have to go meet them in the emergency room. They've just OD'd or whatever, so we can be dispatched anywhere at any given time, so we don't always really know what our hours are going to be.
Is this number I'm saying your cell phone number?
No, that's the office number.
That's the office number. It's very close to my cell phone number. I was like, that is dedication.
I do have a cell phone that you could put up, though, because it's...
Okay. Yeah, we could share that at the end. Absolutely. Now, you guys are on Facebook. If our viewership at home is willing to learn a little bit more, maybe you're seeking help yourself, or maybe you know a loved one who could benefit from Healthy Streets Outreach Program. But www.healthinnovationsinc.com. They're also on Facebook at Healthy Streets Lynn, Mass. This is a North Shore-based organization started in Beverly. It's been around for 15 years. What your focus is HIV/AIDS and overdose prevention. It's a big part of it, educating people as to the healthy way to go about and getting off drugs, as well as training those who are interested, actually educating those who are interested in learning about testings, whether it be HIV testing, hepatitis C testing, or STI testing. One of the things, when I was younger, and luckily I've never had to deal with anything like have to go get HIV or AIDS testing or anything like that. But from what I understood when I was younger, it was like a big long process to get these results back. And you guys say you can get them in 10 minutes.
So that's just for HIV.
Right.
So we have two options. We have the HIV rapid test, which is a 10-minute test. It's a finger stick. We can also do a blood test, which is the blood test. I can tell if you're in the first 2 weeks of your infection, whereas the rapid test, you have to have a 6-week window period. So if you've done anything risky in the prior 6 weeks, we prefer to do the blood draw just because it'll be more accurate. But if it's been longer than 6 weeks, we can give you your result in 10 minutes.
Wow. Now, do you get a lot of people coming in for that? What out of everything that you guys do, which is a lot, and I'm thinking about you guys jazz me up because you're giving your time back, and it's not for anything in return. It's because something in your life has happened and you understand the importance in it, and it's super important to point that out. But what program would you say more people are taking advantage of over there? What do you see more of?
Detox, Narcan, and I would say most people utilize the program for treatment access and overdose prevention.
And
really.
What that says to me is that there are people out there seeking help. Mm-hmm. How do they generally find information about you guys?
A lot of people meet us in detox, or we'd go to a couple other programs. We go to 2 programs in Lynn to do some HIV testing with folks that are in drug treatment. So there, word of mouth. Word of mouth is probably our biggest asset.
I'd say in any situation, any industry whatsoever, it's like, how do you get things done? Oh, I'll ask my friend. This is a guy who knows. And just like you said, they're going to reach out to people. They're not going to go to a mayor or a police officer and say, like, hey, I need help with my drug addiction. They're terrified. So who do they go to? Their friends, their people within their network. So what you're doing, you're going out to these places. You're going to where the need is, and there's a lot of legwork involved. We've been talking about Healthy Streets. It is a outreach program here in Lynn, located at 100 Willow Street on the 2nd floor in Lynn. HealthyInnovations.com, you can find them there. They're also on Facebook, Healthy Streets Lynn, Mass. We've got right now Mary Wheeler and Denny DeRocha. I want to go back to the organization just in case if anybody is joining us right now. Healthy Streets is a program that is here in Lynn. It's focused HIV/AIDS and overdosing prevention program is a big part of it. Let's go back to harm reduction. Tell us a little bit about what type of objections do you face? I mean, like these guys, people come in there, right? I mean, it's not just all fun and games. I mean, like it's not easy. You know, you have to work with these guys, and there's a lot of, there's probably a lot of compensating on your end. Tell us about some past stories. I mean, while you're dealing with harm reduction, I mean, how do you get this across to people? I mean,
so harm reduction in its truest form is, like Denny said, meeting people where they're at. So when you truly practice harm reduction, it actually makes your job a lot easier because you're not being coercive, you're not being judgmental. You're kind of, when a client comes in, we're not saying, you know, you're on drugs and you need to quit. We're saying, how are you feeling? What can I get for you? Is there anything that you need? What's your plan? And then we kind of go along with what that person wants, understanding that human beings don't change overnight, that letting them kind of, you know, make the plan either succeed or fail, and they have respect and kindness and compassion from us no matter what point they're at in their life. And that's really what harm reduction is
now, I understand the goal is to really to just end abuse in general, but you guys know that that's very unlikely. That, you know, there's always going to be a need for this. From a public standpoint, I think it's important to take this into consideration with our government, our elected officials, who's out there striving for it. Do you have any resources for people to, I mean, maybe you have them off the top of your head, any websites where people can learn more about this stuff?
About?
Actually making a difference on their own.
People that are using drugs, or folks
maybe
that
people
are...
who have actually dealt with drugs in their past, who are over them, and they want to give back, just like you guys are.
Oh, God. I mean, they could just look up local substance use treatment agencies in their area, see if they take volunteers for events, see if there's any local coalitions. There's a big one in Saugus, the Saugus Anti-Drug Coalition, and they do a lot. Actually, they're really great. They can always call us and say, hey, do you know of anywhere that's looking for help or support?
Right. So that's good. Guys, what you're doing is outstanding. I appreciate everything that you're doing, especially as a citizen here in Lynn. I can tell you that it's tiresome. You've grown up in Lynn. You know, it's like every day in the newspaper, you're either reading about somebody getting arrested for using drugs, and it's just, they need help. And it's important for us to recognize that. They're not bad people. They're humans.
They're also part of this community. So just because someone picks up a substance doesn't mean you can just kick them out.
Yeah, I mean, the same thing goes for people. I mean, like, you know, it's like, this person's a drug user. Like, you can't classify. It's a demographic. It's a serious one. You know, this person's overweight. It's like, it has no difference between white and black, Asian, all that stuff. So I think that's important to recognize. Real quick, thank you guys again for coming on to the program. Mary Wheeler, Program Director, Denny DeRocha, Community Health Educator, Healthy Streets Outreach Program located at 100 Willow Street on the 2nd floor. You can reach them at 339-440-5633. You can find them on the internet at healthinnovationsinc.com. Facebook, Healthy Streets Lynn, Mass. Guys, thank you for being here. Again, I wish you best luck.
Thank you for having us.
And continue doing the great work that you are. From the studio here at LynnCAM TV, I'm Sean Donahue from the LynnCAM TV Show, wishing you all the best.